coronavirus pandemic has affected our lives, our economy, our health, and has spread to all parts of the world. The rapid spread of new variants offers clues as to how SARS-CoV-2 is adapting and how the pandemic may play out over the next several months. WHO has said that the highly mutated Omicron variant of COVID-19 could change the course of the pandemic. Due to the previous lockdown and work-from-home culture, people's lifestyles have already been severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthy lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the epidemic of diabetes and heart disease. Be it diabetes, myths and facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. If you have any questions you would like to ask them, send them to us via WhatsApp to the following number, which is +91 9167 666 941. That is the number to send us your questions for our experts. Do also send in your name and your location. Let me introduce the panel with us today. We have with us Dr. N M Arun, MBBS, MD Medicine Consultant, Internal Medicine and Diabetes, Quality Clinic, Wellcare Hospital, Palakkad, Dr. Ajay Bahadur, Dr. Colonel Ajay Bahadur, MD Internal Medicine, DM Cardiology, Senior Consultant, Interventional Cardiology, Apollo Medics, Super Speciality Hospitals, Lucknow, and Dr. Sandeep Patil, MBBS, MD, DM Senior Interventional Cardiologist, Head of Cardiology Department, Bhakti Vedanta Hospital, Meera Road, Mumbai. Thank you so much, doctors, for joining us today to discuss something so critical and important at this point. Starting with you first, Dr. Arun, the reduced severity of Omicron is good news for now, but reports do suggest that the next variant could be more virulent. Is it true?
One thing is, you should not think it is very low severity. It is less severe than Delta, that's all. Maybe more severe than our old variant. The new variants will come. It will again come. We are very sure it will again come. Most probably because of our immunity due to previous infection and immunity due to the 2 or 3 doses of vaccines, we will never have a very severe outcome in our coming infections. So most probably corona will become some sort of an endemic disease which comes and goes and produce only very minimal damage, only to a very few number of people, so that it will no longer be a big public health interest, so that we can have a better life or a more normal life maybe by the end of this year. But it's always tricky predicting about COVID. We have all thought that it will be over by last year, but it's again coming this year. So it's always tricky, but still we are hopeful that coming variants will be usually less severe, and because of our immunity, you won't suffer much because of these new variants. Thank you.
Okay, so fingers crossed, less severe, but yes, we do not need to put our guard down. We need to take all COVID protocol. Please mask up. Dr. Colonel Bahadur, as we all have seen, the Delta variant of COVID-19 was more severe and people took longer to recover from the infection as well. What is the general recovery time for the Omicron variant, and what protocol should people follow to deal with the COVID-19 Omicron infection?
As you rightly brought out, the Delta variant was a very severe COVID-19 variant, and it caused almost 6 million deaths the world over, and almost 500,000 deaths in India. So it caused quite a havoc the world over. The present variant Omicron, again, has brought out, it's relatively milder. It is not causing very many deaths. The oxygenation requirement rate is lesser. The hospitalization is lesser. So we are looking at a variant which is relatively milder. However, having said that, the infectivity rates, the transmissibility rate is very rampant. It is spreading very fast. The doubling rate is 2 to 3 days only. And we are seeing the numbers increasing in a geometric progression. The admission rates, as I said earlier, is lesser. The symptoms are of cough, body ache, throat pain, headache, and some amount of running nose. The infection lasts not for very long, luckily. The good news is almost 90% of the patients are asymptomatic, and the infection generally takes symptomatic phases 3 to 5 days only. As regards the precautions and the protocol is concerned, we follow very simply said SMS. That is soap, mask, and social distancing. Soap means frequent hand washing, use of sanitizer. social distancing, as I mentioned, and use of mask. One last line, vaccination. One of the most important shields that we have. It has been well proven that severity of infection, frequency of infection, hospitalization rates, and deaths have been reduced with vaccination. So we must have more and more vaccination drive and awareness,
So like you
which
rightly,
we already have actually.
yeah, like you rightly said, vaccination, and the way you put it, SMS is an easy way for I think all of us to remember soap, which means washing your hands, and of course masking and socially distancing ourselves. Dr. Patil, previously many people suffered from long COVID effects, post-COVID recovery. What are some possible complications after recovering from Omicron?
Yeah, definitely. We are also expecting some complications of Omicron, though it's less lethal but more infective. It is 2 times more infective than the Delta virus. But as we, in previous waves also, as we have seen, there are long-term complications in the form of psychological effects like anxiety and depression were seen in most of the patients. And the predominant involvement was the lung. We see fibrosis in the lung, and a patient may have a breathlessness over a long period of time. Then even as far as cardiac system is concerned, we have seen there is variation in the heart rates in long term, like tachycardia, a high heart rate or a low heart rate in patients with COVID-19, as well as the other systems like GI system and the kidneys get affected in long term. But it is very early to say in Omicron. But definitely we are seeing some pneumonias with Omicron also. But as we discussed, vaccination proven to be boon because the long-term complication rate is also 50% less with the vaccination people. So the message is more and more vaccination and less lethality, less death. Though the infectivity is high, definitely the complication rate is lower if you are vaccinated.
Yes, so again, it comes down to that vaccination is key here. Dr. Arun, hypertension acts as a precursor to diabetes. It is also observed that most people with diabetes are also at increased risk of developing hypertension. Can you please tell us about the common causes of hypertension and diabetes, and how are the two really linked to each other?
We very well know that hypertension and diabetes are very closely linked to each other because of very common etiological factors. There are a lot of etiological factors which are common. One is again genetics. Same family, in the same family, you can have the same genes in both diabetes and hypertension. Then comes the lifestyle. Lifestyle, again, both hypertension occurs more in obese people. Diabetes also occurs in obese people. So that's one thing. Those people are very stressful lifestyle, very stressful lifestyle without sleep, always worrying about their work. Such people definitely can develop hypertension. Then can also develop diabetes. Then comes the diet. So people eating a lot of salt and eating a lot of refined sugars, a lot of carbohydrates. Again, they can develop both hypertension and diabetes. So there are a lot of common etiological factors for diabetes and hypertension. So it's very important that when a patient is hypertensive, you should look at the diabetes level, that is sugar levels, very frequently. When a patient is a diabetic patient, should check their hypertensive BP level very frequently, so that both are controlled very well together, so that they can prevent all the complications and live a normal life.
Okay, so since they are linked, I mean, it's important to keep a check on both of them together. Dr. Bahadur, what is white coat hypertension and masked hypertension, and which one is clinically significant, and how can one really differentiate between the two?
This is a very good question, actually, to understand the concept of masked hypertension and white coat hypertension. I'll first deal with white coat hypertension. As the name is obvious, when a patient comes to a hospital and the blood pressure is taken, the sheer effect of the white coat causes the blood pressure to go slightly up. So that is actually more because of anxiety and a individual coming to hospital. That really doesn't mean the person has high blood pressure and needs treatment. However, it has been seen that such people who have white coat hypertension may go into frank high blood pressure and hypertension, may require drug treatment later. So one has to understand that almost 10 to 15% of general population may have white coat hypertension. So we keep a watch on that. Okay. Second concept is the masked hypertension. Masked hypertension is when a person comes to the hospital or the OPD and the blood pressure is recorded as normal. However, when the patient takes a home blood pressure, that recording is higher than normal. That is masked hypertension. And this generally happens, it's been found in young anxious males, smokers who use alcohol regularly, these people who are stressed at work, they have masked hypertension. Both these subsets, that is white coat hypertension and masked hypertension, which is also called reversed white coat hypertension, both these individuals are at risk of high blood pressure in the subsequent times and should be under check. And the test ideally to differentiate these two versus a frank hypertension is ambulatory blood pressure monitoring. So we have a machine with which we can, attach to the patient, and it's recorded for 24 hours, and then we read that.
Okay, so I think you've explained that really well, and it's interesting to know how they both are quite different. Dr. Patil, a close link exists between hypertension and cardiovascular disease. How does hypertension increase the risk of cardiovascular events? Can it also be prevented?
Yeah, definitely. See, if you see, the commonest cause of cardiovascular complication is in hypertension. So how it affects is, if you have a high blood pressure for a longer period, then the blood vessels which are supplying to the heart as well as to the other important organs like brain, their inner layer gets damaged, and that is how the collection of cholesterol and other cells gets started, and then the blockages that they get formed inside the coronary arteries, and you get heart attacks, and this is how the heart muscle becomes weak. So this is how hypertension can complicate the cardiac system. The other ways hypertension can damage is the heart has to work under more pressure. That is how the heart's muscle gets thickened, and eventually the heart fails. That is called as heart failure with the preserved ejection fraction. Then the hypertension also can cause some rhythm related issues in the heart, like atrial fibrillation, where the heart rate is very fast and irregular. Other rare complications of hypertension are abnormal dilatation of the vessels which are coming out of the heart, like aortic aneurysm. So as I said, hypertension has to be controlled, because if you don't control it, it is called as a silent killer over a period of time. It will damage majority system in the body. Like important system is cardiovascular system, will get more heart attacks, more heart failure patients. So it can be preventable.
So since you've explained us that how it affects the heart, and how hypertension needs to be prevented, it needs to be controlled, that's very, very critical. On that note, we're going to be taking a short break. If you have any questions you would like to ask our experts, please send them to us via WhatsApp on +91 91 67 666 941, and this is the number to send us your questions. Also do send us your name and location. We'll be right back after the break. Welcome back. You're watching Beat Diabetes Myths and Facts. Dr. Arun, we have a viewer question which is very interesting. He's asking, people with diabetes are always in dilemma about their diet choices. What kind of food can a person eat while on insulin?
Whether a patient is on insulin or on a tablet, diet is not much different.
Okay.
We have to concentrate on the quantity and the quality.
Sure.
When you mean by quality, the amount of refined carbs in the diet, amount of saturated fat in the diet. We have to reduce refined carbs as much as possible. That means all kinds of sugar, honey, jaggery, when the white rice, maida, like that. And also you can reduce saturated fat. To include the ghee, butter, all the fried items, or especially the trans fat and all. And then the quantity. Especially if you are an obese patient, you have to reduce your quantity very much, so that you should have to try to reduce your BMI, body mass index, to some sort of around 23. That will be the ideal weight. If you are taking insulin, there is a possibility of getting hypoglycemia, that is low blood sugar also. So you should ideally take small and frequent meals. There should not be a big gap between two meals. But especially you should try to cut down the sugars as much as possible. Try to cut down the saturated fat as much as possible. Take more fiber. You can take fruits, but in a limited quantity, especially those fruits with low glycemic index fruits, and do regular exercise. This should be a correct, correct diet for a person either taking insulin or taking an oral tablets.
Okay. So along with, of course, eating the right kind of food, it's important to exercise as well. Dr. Colonel Bahadur, what is atrial fibrillation and how serious is this condition? Can it lead to serious cardiac events?
Okay, so atrial fibrillation is actually a rhythm disorder of the heart, wherein the upper chambers of the heart, the atria, work in a discoordinated manner with the ventricles. The coordination between the atria and the ventricles is lost. And this leads to a relatively faster and irregular heart rate. The effects of these are that patients can have blood clots forming inside the heart. They can have clots forming elsewhere in the body. Complications like stroke, heart attack, heart failure, these things can occur. These patients at times can be asymptomatic, and some patients may have symptoms like palpitations, irregular heartbeat, fatigue, breathlessness and exertion. So that's what atrial fibrillation is. And yes, as you asked me, the complications and the risks of atrial fibrillation are that it can lead to stroke, heart attack, heart failure, and even subsequently death.
Okay, so no, thank you for explaining that. That means one should visit a doctor. Dr. Patil, should the heart disease or hypertension medication doses be revised while people with cardiac conditions are working from home, keeping in mind that they do tend to put on some more weight?
Yeah, definitely. This is an important question because nowadays we are facing this work from home activities since last 2 years. So we are seeing lots of patients are gaining weight, but they are not very serious regarding that. They say, what is the big deal in this? But if you see the studies, BP is the most sensitive parameter for the weight gain. Even if 2.5 kg increase in the blood pressure will weight will rise in the blood pressure, while other parameters are not that sensitive. If you see glucose, lipid levels, as well as insulin levels, up to 5 kilogram increase in weight, they will not change. But if you see the blood pressure, where the blood pressure fluctuates once the weight started gaining, particularly around the belly. So what advice we should give to the patient is during the lockdown period, utilize this time for the exercise, have a good diet at home. So we can very well save that time giving to the exercise and diet. And nowadays, as far as the cardiovascular risk factor is concerned, if you don't have any physical activity, it is equal to the smoking as far as the cardiovascular events are concerned, heart attacks are concerned. So that is that important. So importance of exercise, reducing the weight, and a good diet. These are important factors one should be focusing while we are at home. Definitely we have ample of time. We can utilize and have a good consultation regarding the exercises, diet.
Sure, I think that's a very important point, what you pointed out, that if your weight is increasing, blood pressure increases, there is a link between that. So that is something, again, of course, more importantly, one does need to exercise and eat well. Dr. Arun, exercise helps people with diabetes to control their blood sugar. If a person works out, does that mean he or she can eat whatever they like?
No, I think whether you are doing exercise or not, better to keep the same diet. Because, okay you can give a small treat occasionally, but depending on your weight, one is your body weight is most important. So if you are not obese, you are very slim and you're doing good exercise, you don't have much comorbidities, if you're not having diabetes or hypertension, then you can eat anything, that's okay. But if you're having diabetes, you are having hypertension, then better always be use low sugars, high fibers, less refined carbohydrate, that is always there. So maybe you can give a treat once or twice, you are doing good exercise, you have burned off lot of calories, then you can get a treat of, say, a chocolate or something like that, or a sweet, some sort of Indian sweets like jalebi or something like that. Otherwise, I think better to stick on to a very strict diet, then only you will get the whole benefit of exercise. Otherwise, whatever you lose from exercise, you may again gain by eating things. Thank you.
So once in a while, like you rightly said, it's okay to treat yourself, but otherwise stick to your diet so that you can keep your sugar levels in control. Dr. Colonel Bahadur, many years of scientific studies have shown a close relationship between cardiovascular disease and cholesterol levels. Should one really focus on lowering dietary cholesterol or saturated fat?
Okay, so this is a very, very important question because, you know, it's applicable to, it creates a lot of confusion among lay people as to what is correct, whether cholesterol is good or bad. Let me start briefly with the history. Actually, this all started in the 50s, and Dr. Ansel Keys was spearheading a study called the 7 countries study. It was conducted in 7 countries, and the diet was studied and the effects on heart. So it was found that high cholesterol would lead to heart attacks. This was the conclusion of the study, and people went on an all-out war against cholesterol, and every food containing cholesterol was considered to be bad. Over the years, science has evolved and realized that it's not so, and cholesterol is actually a very important chemical in the blood, which forms hormones, which repairs cells, which is required to absorb vitamin D, fat-soluble vitamins. There are a lot of advantages and benefits. It's a very important energy fuel. Almost 25 to 30% of our diet, the calories should be from fats. So there are plenty of advantages of fats and cholesterol. It's not all bad. That's one important fact everybody needs to understand.
Okay.
Yes, excess of cholesterol, excess of fats, excess of especially saturated fats and trans fats are unhealthy.
Okay.
So it's the quality of fats which is very important. And when we are watching cholesterol, we watch total cholesterol in the blood as well as the lipid profile. That is various elements, that is the LDL, HDL, VLDL, various elements of the cholesterol. So there is good fat also. Cholesterol is important, and all dietary cholesterol is not bad.
Yeah.
Also, one has to remember that it's only 20% of dietary cholesterol which is contributing to high cholesterol. 80% of cholesterol which is high in the blood is because of a biochemical process. It's the liver, it's the chemical factory. So cholesterol is good also.
Yes, it's good also, but one needs to keep a track, and I think what you really explained it well for our viewers. Dr. Patil, there have been apprehensions that birth control pills can cause a heart attack. Are birth control pills really a contributor to heart disease?
Yeah, it's an important question because many of the people, they don't know what are the effects of oral contraceptive pills on the cardiac system. It is widely studied. If you see the newer generation oral contraceptive pills, that is progestin only pills, they are relatively safer as far as the heart is concerned. But the mixed variety of oral contraceptives, definitely they have some issues. Though the cause and risk ratio is not that proven, but definitely they can hamper the heart in terms of increase in blood pressure. Their cholesterol will get disturbed. The weight they will have a weight gain, as well as some patients, if they are genetically prone, might get clots in their veins, that is called as deep vein thrombosis. It can be fatal sometimes, causing pulmonary venous thrombosis. That is how, before starting these oral pills, we should be sure that if the patient is hypertensive or diabetic, his blood pressure and sugars are well controlled. If they have an addiction like smoking, they should quit smoking.
Sure.
And the other risk factors should definitely controlled before starting the oral pills. So newer generation definitely are little safer, but for the mixed variety of oral contraceptive, we should be little cautious in correcting all those risk factors.
Okay, I think thank you so much, Doctors. You have explained all this really well. It's important that we eat well, we take care of our exercise routine, I think those are some very important things, and you'll have clarified so much for us. Thank you all so much for joining us today.